If you perform a bone marrow, the other problem is that you are only assessing one specific site in the bone marrow, so you can miss foci of extramedullary disease. So what we have done is to compare in parallel within the GEM-CESAR trial the results of the treatment response with the conventional methods, that is SPEP immunofixation, with the new method, which is the mass spectrometry, and the MRD assessment in the bone marrow with NGF. So we have done that in the 90 patients included in the GEM-CESAR trial, and we have done that post-induction, post-transplant, and post-consolidation. So the first thing that we have seen is that mass spectrometry is able to identify all the isotypes identified by the conventional SPEP. Plus, we found 5 additional M proteins obviously in 5 patients. We also identified 6 cases of glycosylated M proteins. So then, so the first thing that we did was to compare the conventional method, that is the serum protein electrophoresis with mass spectrometry, and we saw that so then sensitivity of mass spectrometry seems to be higher post-induction, post-transplant, and post-consolidation. When we compare paired samples along the treatment, what we saw is that the percentage of concordance remains stable all along the treatment, changing from both positive to both negative under the effect of the treatment. And there were no cases that were SPEP positive, mass spectrometry negative. So all the rest of the discordances were due to the higher sensitivity of the new method. So then in a second step, we compare mass spectrometry with NGF, and what we saw was again the same, so a higher sensitivity post-induction, post-transplant, and post-consolidation with the mass spectrometry method. And then again, the percentage of discordances was stable along the treatment, changing again from both positive to both negative under the effect of the treatment. And then there were discordances in both sides, approximately 20% of discordances favoring mass spectrometry and 10% of discordances favoring MRD. So to analyze these discordances, what we did is to find an explanation for these discordances. So we thought that patients mass spectrometry positive, MRD negative could be due to patchy disease or to extramedullary disease, and on the other side, patients with NGF positive, mass spectrometry negative could be due to the fact that those patients, there were 22 in fact, were in the limit of detection of NGF. That is, those patients had a very low MRD levels. And then to end up, we analyzed, so far we have had 6 progressions in the GEM-CESAR trial. So we analyzed the response profile of these 6 progressions. We have seen that the 2 patients that progressed post-induction, so one of them was positive by the 2 methods. The other one was mass spec negative and NGF positive. There were 3 patients that were positive by the 2 methods all throughout the treatment. And the last patient was always positive by mass spec, but NGF negative. So in conclusion, what we have seen is that the new method, that is mass spectrometry, seems to be more sensitive than the conventional methods and could potentially replace the SPEP immunofixation in the routine clinical practice. We have also seen that mass spec seems to be more sensitive than flow cytometry, but we need more follow-up to resolve the discordances that we have seen.